21st July 2021. That is the report that is being read. Is that the report you're reading? Yes. Yes, the leader of opposition. When your leader of opposition is speaking, you sit down.
Right Honorable Speaker, I thank you for your indulgence. I have listened to the Prime Minister's submission relating to members' concerns on the additions on her statement that were not received a priori as per the rules. The rules have no provision for an extra, additional, or docketed report. And it's only the Speaker to guide this House as to whether I received the additional copy about 15 minutes ago, and I'm trying to contend with the additional contents. And I want to put it to the Prime Minister that it's an act of disingenuity to try and move the House to debate matters in haste as if her statement is a matter of urgent national importance that she had no prior knowledge to. I would like to ask the Speaker to guide the House, probably demand that the Prime Minister sticks to her original statement. And if she has additional issues, she'll bring them as a way of clarification. Otherwise, the confusion she's bringing to the House has no space in the rules, Right Honorable Speaker.
Leader of opposition, remember when we adjourned the House, we agreed the Prime Minister should go and adjust her report to respond to the questions that were raised in regard to COVID-19. Unless if we are saying that is not captured, then she should stick to her original report, then answer those questions afresh.
Thank you, Right Honorable.
But you should also appreciate if she's reporting in terms of figures, the figure on Thursday is different from a figure of today. That can be adjusted. Is that agreed?
Thank you so much, Right Honorable Speaker, for your wise ruling. I'm glad to report that the daily caseload, including hospitalization, have significantly dropped in the past 2 weeks. This is what the lockdown was intended for, to slow down the rapid transmission and restore our health system that had been overstretched and degraded by the huge numbers of patients. Evidence from elsewhere, and from the fundamentals of infectious diseases control show that lockdowns and restrictions in the movement of persons slow down and reverses the rate of transmission. Given the long incubation period of the virus of 14 days, our scientists and the Minister of Health had predicted that the reversal may happen after 3 to 4 weeks. Preliminary epidemiological and clinical data shows that we may have passed the peak of the current wave. However, we must be cautious on this apparent downward trend, given COVID-19 unpredictable microdynamics detected by community and social interactions which vary. The Minister of Health, working closely with the local governments, are monitoring this situation closely. Right Honorable Speaker and colleagues, in the 42 days lockdown, government is doing the following: enhancing measures to interrupt transmission of COVID-19 among healthcare workers and communities. We are strengthening measures to control transmission within communities through the district and village task forces. We are streamlining and strengthening home-based care for COVID-19. We are continuing with vaccination. We are addressing gaps that were identified in the last wave, such as enhancing oxygen availability, strengthening port health at border points of entry, increasing the number of vehicles for surveillance, and training more health workers on critical care. Since the entry into the second wave of COVID-19 pandemic, which is driven by the presence of Delta variant, there is an increased demand for care of people with COVID-19. The Ministry of Health continues to implement the home-based care strategy, which started in the first wave. This strategy reduces pressure on health facilities from overload with patients who have no symptoms or those who are mildly sick and don't require sophisticated clinical care and can be monitored in their homes. In this regard, that Honorable Speaker, the Ministry of Local Government received 52 billion to facilitate COVID-19 response at local level across the country. The disbursement of funds is as follows. District local government, 150 million, cities, 150 million, municipalities, 100, village health teams, 300 per village, and village task force, 100 per village. This will support their implementation of the community-based engagement strategy for COVID-19 response, as well as the enforcement of the presidential directives at district and community level. The objective is to ensure that all people in Uganda are aware, organized, empowered to participate actively in the prevention and control the pandemic. That Honorable Speaker, unlike the first wave, where the majority of severe and critical cases were above the age of 60, the second wave is characterized by a shift to high numbers of cases among the age group below 40. The rapid rise in the number of cases has had an overwhelming impact on the provision of clinical care. There has been a significant increase in the number of cases admitted by isolation facilities. Again.
Thank you, Right Honourable Speaker. Right Honourable Speaker, the Right Honourable Prime Minister, she's making us to get confused the more. You guided very well that the Right Honourable Prime Minister should first read the old report and emphasize on any other additional information. Right Honourable Speaker, what she's reading is quite completely different from the documents we are having. Right Honourable Speaker, I request through you, let the Prime Minister read first the first document and she will supplement on the other information that she feels like. Otherwise, we are getting more confused and we are not following what is going on. I beg to move, Right Honourable Speaker.
Do you have the new report? Honorable Gilbert, do you have the new report? It is uploaded. Check on your whatever, on your WhatsApp. Members, we've agreed. The leader of opposition has a right to reply. He's going to reply and respond to whatever is being presented. Leader of opposition?
Right Honourable Speaker.
Leader of opposition.
Before you proceed, I think to settle the nerves of the House is to draw the boundary for the Right Honourable Prime Minister that we can avoid overlapping statements not available to the members. That's just like you had guided. Probably I thought she had picked her old copy and that we had agreed that in her response to the debate, should use that space to bridge the gap between the information available to the members hitherto and then bridge them with additional information. Otherwise, she is increasingly sowing confusion and making the entire presentation look scattered, Right Honorable. If she had stuck to your guidance, would be far, I suppose.
Yes.
Right Honorable Speaker, the issues of COVID keep evolving. There are some issues that were asked the other time, and you guided that I should embed those very issues in my report, and I'm answering the same. That Honorable Speaker, I request you to provide. Right Honorable Speaker,
Proceed,
I
Honorable
request you.
Speaker.
Members, we in this very house, and I was the one chairing. I told this Prime Minister to avoid you repeating this kind of things. Can you go and include what has been raised into your report? Huh? Now, if you cannot respect the decision that was taken, that was the basis of sending back the report. Now, so for me, if what we asked has been included in the report,
Order.
and I want you to check where the old report was uploaded is where the new report is uploaded. Check where the old report was uploaded is where the new report is.
Procedure, Madam Speaker.
Honorable Speaker.
Procedure, Speaker.
Procedure, Honorable
Madam
Speaker. We are
Do
seeking for
you have the
indulgence.
new report?
Order.
No.
Madam
Honorable
Speaker.
Speaker.
Order.
Members, do you have the new
Procedure,
report?
the Right
No.
Honorable Speaker.
Madam
Order.
Speaker, procedure.
Order,
Procedure, Madam Speaker.
There is an order there.
Madam Speaker, is it really in order for honorable members to keep confusing the House without referring to any specific date of the report they are talking about? I have a report that was shared on 14 July 2021, and what our Right Honorable Speaker is presenting is not any different. There are only difference in the data, but not the content. Thank you.
Members,
Procedure,
Members.
Right Honorable Speaker.
members, please first.
Procedure, Madam Speaker.
Members first
Right
sit.
Honorable Speaker.
Right Honorable
Procedure,
Speaker.
please.
Members first sit. Members, please first sit. There was an old report of 14th. It was uploaded, yes or no? There is a report of 21st. It has been uploaded. Madam Clerk, can you tell us whether you uploaded or not? A moment. Let's sort out things one by one. Let's sort out things one by one. But they are on white, it is everywhere. The report. Members. Can you allow me chair this house? You asked for an update of a report. Huh? Order. Prime Minister, go ahead.
Thank you so much. Right Honorable Speaker, on May 2021, for example, admissions were 10 to 20 new cases daily, and this increased to an average of 120 cases daily.
Madam
The majority
Speaker, procedure.
of the admitted have several and critical conditions that require high dependency and intensive care
Madam
support.
Speaker,
This
procedure.
drastically
Members.
increased the oxygen requirement.
Prime Minister, just hold on.
Each
Prime Minister.
COVID-19 patient,
Prime Minister,
Procedure.
hold on. Madam, the House, I request of you, take note of what has been added. Let's follow what is happening. Unless if you're saying, we still adjourn the House because of this very
No.
important issue. Huh? I am not allowing any procedural matter. Can we?
Right Honorable Speaker, for example, the other day,
Madam Speaker, procedure.
Madam Speaker,
Can we listen to the report and we debate, we bring issues to the report?
Madam Speaker,
Listen to
when
the
we
report.
say it is
Have a
uploaded, do we already have iPads in order for us to say it is uploaded?
Your phones, WhatsApp. Prime Minister,
Madam
go
Speaker,
ahead.
procedure.
Right Honorable Speaker, let me give an explanation. For example, Right Honorable Speaker, the other time members said they wanted to have copies of the beneficiaries. I have come with copies, and that was not in the last report. So allow me to present.
Then give out.
Speaker.
We cannot
I have come with
from your hands.
the other time I had not come with
Give the
the
copies
beneficiary.
out.
It is here. Allow me to present members.
Madam Speaker,
Procedure.
Madam Speaker, procedure.
Procedure, Madam Speaker.
Right Honorable Speaker, I
Madam
request that you
Speaker.
make a ruling and we move.
Procedure,
Members.
Madam Speaker.
Members. Can I have order in the House?
Proceed with the speech.
Not there.
Proceed.
Members,
We proceed,
Thank you so much, Right Honorable
Members.
Speaker.
members, I am going to make my ruling on this. Let's listen to the report, take note of the report, and I want to tell you, whichever member is going to continue disturbing, I will apply Rule 79. Can you read the report?
Right Honorable Speaker, thank you so much for the wise ruling. In May 2021, for example, admissions were between 10 to 20 new cases daily, and this increased to an average of 120 cases daily. The majority of these admitted have severe and critical conditions and require high dependency or intensive care support. This drastically increased the oxygen requirement. Each COVID-19 patient consumes 4 to 6 cylinders per day, as opposed to 1 to 2 cylinders per day for a non-COVID patient. In some extreme cases, patients with severe lung damage would even require up to 12 cylinders of oxygen per day. Right Honorable Speaker, government has been addressing the issue of oxygen and aims at a permanent solution. In the meantime, government and partners have procured several oxygen cylinders to supplement the needs of the isolation facilities. Oxygen from the pressure swing adoption system has been in the use in Uganda for a long time. This oxygen is produced in a gaseous form and cumbersome to distribute to the entire country. To address this, government has begun a process of procuring and installing psychogenic, that is liquid oxygen plants, whose oxygen purity is as high as 99.7%. The shift to liquid oxygen is guided by the very high purity levels, the ability for production and storage of high volumes of oxygen, and the less cumbersome way of transporting the psychogenic oxygen tanks to fill the cylinders at different facilities. Psychogenic oxygen plants will be installed in all regional referral hospitals and at national medical stores to serve the needs of the national and specialized hospitals for both COVID-19 and non-COVID patients. 4 units will be installed at the national medical stores to produce 5,000 cylinders per day. Government is also procuring 7 psychogenic oxygen trucks to deliver oxygen to general hospitals and health center force. This will eliminate the cumbersome process of carrying cylinders to and from the health facilities. Psychogenic trucks carry liquid oxygen at very high pressures and huge volumes, which can be converted into gas at the facilities and filled into the cylinders. Over 6,000 cylinders will be procured and distributed to all facilities for this purpose. That Honorable Speaker, today, I'm happy to report that I received 300 cylinders from Nairo breweries this afternoon. The requirement for huge amounts of oxygen and medical supplies include medicines and personal protective equipment for the healthcare workers has driven the cost of COVID-19 treatment way above what an average Ugandan can afford in private health facilities. Some private health facilities and providers were reported to be charging exorbitant prices. The Ministry of Health and my office engaged them to understand the dynamics and support reduction in prices. It was discovered that the cost drivers were personal protective gears, especially the coverall, huge amounts of oxygen required for critically ill patients, multiple drugs required for those with severe ailments, and the necessary laboratory tests to monitor the patient's condition. It was resolved that the private facilities should stick to the Ministry of Health guidelines for the management of COVID-19 patients to avoid unnecessary costs, which include the burden to the patient. Colleagues, in the absence of an effective treatment, vaccination remains an important control measure for COVID-19 pandemic. If all eligible persons are vaccinated, we can open our economy and avoid the lockdowns, which has driven our population into more poverty. Government is therefore using a multiple-pronged approach to secure vaccines for the 20 million remaining eligible individuals through the following acquisition protocols. Direct purchase of vaccines through COVAX facility. Direct purchase of vaccines through African Union. Direct purchase of vaccines from the open market. Various vaccines have been listed for use in Uganda, including AstraZeneca, Covishield, Pfizer, Johnson & Johnson, Moderna, Sinopharm, and Sinovac. In the content of the global scarcity of vaccines, government through our missions abroad is aggressively searching for the available source and will procure the vaccines that we can access. Many of you will recall that in the budget speech, Uganda shillings 560 billion was allocated to COVID-19 vaccinations. The Minister of Finance can affirm to this and its availability. This may not be enough, as this August House may be called upon to provide additional resources as is required. Honorable Speaker, when HE the President announced the second lockdown to prevent the rapid spread of COVID-19 on 18th June 2021, He mentioned that government was aware that the lockdown measures were likely to negatively affect the poor and the vulnerable persons across the entire country. In order to address this, HE the President directed me as the Prime Minister and the Minister of Gender, Labor and Social Development to, one, identify the groups that depend on daily earnings in urban areas. Two, identify interventions to take care of their needs. Honorable Speaker, I wish to inform you that since that directive was made, government undertook verification exercise of the vulnerable people in Kampala metropolitan area, all cities and municipalities. And the Minister of Finance released 53.5 billion to provide relief to those who were considered. I will now provide the progress report as below. The total number of targeted beneficiaries, households, was 501,107 across the cities and municipalities. The total number of beneficiaries paid as at yesterday, 4 p.m., totals to 400,135 beneficiary records had been submitted to the bank and paid, which represents 82.5%. That totals to 41,350,400 shillings, Uganda shillings. Honorable Speaker, number 3, failed submissions and payments. Out of the total number of 1,107 records submitted to the ministry, a total of 87,603 records did not pass the verification requirement by telecom databases due to the following reasons. 1, invalid ID numbers presented. Telephone numbers registered under different names from the national ID names. Non-existence or non-registered telephone numbers. Non-mobile money registered numbers at payment level by bank. The failed numbers have been sent back to the cities and municipalities for correction before payment can be made. The clerks have been guided and trained by the Minister of Gender, NITAU, on what to do. Accordingly, Honorable Speaker, and in light of the directive from Cabinet, the following categories of people have been the beneficiaries of the cash transfer, the Nabanja cash. These are the categories: the bus and taxi drivers, conductors, baggage couriers, wheelbarrow pushers, touts, traffic guides, and loaders in taxis, bus parks, and stages, in the other major commercial centers such as Chikubo. Barmen, DJs, barmaids, waiters, and bouncers. Bar, gym, restaurants, and restaurant workers. Food vendors in the bus taxi parks and arcades. Artists, musicians and comedians. Border riders, special hire drivers and Uber drivers. Saloons, massage parlor workers. Teachers and support staff in private schools and teachers in government schools not on government payroll. Car washers, slum dwellers, commonly known as ghetto residents, street and food vendors, shoe shiners, and cobras. Right, Honorable Speaker, this emergency intervention was a short-term relief and not meant to address the high poverty levels, which can only be dealt with in the long term. I humbly request that you explain this intervention of extending support to the immediate COVID-19 vulnerable caused by lockdown in the Kampala metropolitan area, cities, and municipalities to your people, so that they understand that we are not discriminating against anybody. As we continue to mobilize resources, other vulnerable categories may be considered. Besides, other government programs such as Women Fund, EMIOGA, Operation Wealth Creation, Youth Fund, SEDGE, Disability Grant will continue to support other vulnerable groups In addition, the parish model program is on course this first quarter. Honorable Speaker and honorable colleagues, this exercise of providing relief support to our people has shown us that we need, one, to invest in collecting, analyzing, and documenting data about our citizens accurately. For example, in the process of verifying beneficiaries, we found that some of the people's telephone numbers were registered under different names from those on their national identity numbers. In other cases, beneficiaries submitted telephone numbers not registered on mobile money. While in other cases, beneficiaries had telephone numbers that are not registered with the telephone companies. Such gaps and inconsistencies have caused the delay and affected this exercise dearly. This is the first time government is carrying out intervention of this nature in a short time and in such a magnitude. Therefore, challenges are bound to happen. The important thing is that lessons have been learned, and we shall do better in similar programs in the future. Honorable Speaker and honorable colleagues, regarding the management of transport and movement of essential vehicles in essential sectors, the Ministry of Works, Transport, together with NITA-U, developed an online application where details of all persons and vehicles permitted to move during the lockdown have been managed. Under this system, 28,916 movement permits out of 36,479 applicants have been issued. Some of the 7,173 applications are pending approval, while others were rejected. Those rejected did not meet the strict criteria of complying with the essential services. In addition, Ministry of Works Transport continues to facilitate travels for emergencies such as medical appointments and burials. To facilitate cross-border trade, HE the President directed that Entebbe International Airport remains open. This continues to be the case while following strict SOPs, such as routine disinfection of premises, installation of automatic sanitizers, mandatory PCR COVID-19 test for airline crew, and testing of travelers. Right, Honorable Speaker and honorable members, enforcement to ensure that all schools and institutions of learning remain closed for 42 days has been effectively undertaken, and crackdown on the errant ones continues. The Ministry of Education and Sports and the Ministry of Health are developing a comprehensive plan for a phased reopening as we work towards mass vaccination. The Ministry of Education and Sports has put in place alternative learning initiatives and will continue to perfect them for the rural areas. I would like to conclude by saying something about National COVID-19 Fund, which was established by HE, the President, to mobilize donations for COVID-19 response. Through that effort, 29 billion was raised, and we thank all Ugandans and friends of Uganda from all walks of life who contributed to this cause. This donation was banked on the COVID-19 account opened in Stanbic Bank and transferred to the Consolidated Fund directly. On 28th May 2020, the appointed management of the fund met HE the President and agreed to use the 23.9 billion of the fund to purchase 282 double cabin vehicles to give at least a vehicle to each district, municipality, and cities in Uganda to support the activities of their response to COVID-19. Another 3.3 billion was earmarked to construct a blood bank at Soroti Regional Referral Hospital, while 2.4 billion has been put to construct port health facilities at Chanika and Vura, while Busia and Maraba are being constructed under Government of Uganda funding. That Honorable Speaker and colleagues, I am pleased to inform you that 121 out of 282 vehicles have already arrived in the country and are undergoing clearance, including provision of number plates, while the rest are in transit and expected anytime soon. In addition, I would like to inform you, honorable colleagues, that at the start of the response to COVID-19 pandemic in March, government decided to procure an additional 38 ambulances to add on the existing fleet to support emergency medical services. By the end of last year, these ambulances, which include 3 water ambulances, had arrived and are currently in use in various parts of the country as per the emergency medical services policy and strategy. Honorable Speaker and colleagues, this is an updated report as of today, like I told you earlier. I'm aware of the presence of the Parliamentary Task Force on COVID-19 in the field. Obviously, government is aware of those gaps that need to be addressed. There is no system without challenges globally, and the government is committed to put in place mechanisms to address these challenges. In regard to the management of COVID-19, we are not using all hospitals as isolation facilities. There are numerous other patients that require medical care for other conditions. As such, the general hospitals, Health Center 4s and Health Center 3s have been reserved for such cases. In any case, even the isolation facilities in the regional referral hospitals are away from the areas where other conditions are treated. That's why the Ministry of Health emphasizes the need to admit only severe and critical cases that require specialized care, while the rest can be treated at home. I would like to end by sincerely thanking you, honorable members, for the support you have consistently given to the response towards this pandemic. Together, we shall win this war. Allow me to lay on table, ladies and honorable members, as you guided Right Honorable Speaker the other time, a copy of the beneficiaries for the relief payment who have benefited from this COVID relief fund of Guru City.
Thank you.
I will bring them at once. You can see how big the volume is. This is only Nakawa division. So I have decided, Honorable Speaker, to bring a flash containing all this information of the beneficiaries we have given this money. Right, Honorable Speaker, like I told you, we are struggling and we must fight corruption up to the letter. That's why we are in an era of accountability and transparency. Allow me to lay on table these documents.
Members, as the minister lays on table the list of beneficiaries of the so-called Nabanja cash, I am ordering PAC local government and PAC Central to scrutinize those documents and confirm whether those are the right beneficiaries and report back to this House. The report has been presented.
Right, Honorable Speaker, allow me to say thank you, especially for the guidance you gave so that I can read my report. Thank you so much.
Member, thank you for your cooperation. We've had a report from the Prime Minister. Before I invite the debate, can I have, you're aware that the law has a right to reply. Can we have the leader of opposition?
Thank you for your kind indulgence, Right Honorable Speaker. I would like to appreciate my dear sister, the Prime Minister, for hazarding to present this report in whatever form it is. We shall take it. We shall with time appreciate your methods of work and adjust accordingly, or invite you to stick to the tenets of the House. I will use very few minutes, Right Honorable Speaker, to make brief commentary on the presentation of the Right Honorable Prime Minister to this House. Right Honorable Speaker and colleagues, on the 14th of July 2021, we received the response of the Prime Minister by way of circulation. It should be noted that from the onset, the statement is indicative of the appalling approach of government in the management of COVID. Its response is largely deficient of the required momentous strides that merit commendation. I should have done as a matter of courtesy to the Honorable Prime Minister. I am hesitant to say that on another day I would have condemned her, but I will reserve the condemnation to another day. Right Honorable Speaker, every citizen is feeling the wrath of having a government that makes incomprehensible planning and decisions, as I'm going to highlight briefly. Let me comment on the overall government response. If I was a terrible human being, I would have called it government posturing. It is evident, Right Honorable Speaker, that government response focuses on ad hoc interventions in health and social protection, neglecting dividends that would arise from a comprehensive review of undertakings in other sectors such as education, infrastructure, taxation, security, decentralization, among others, Right Honorable Speaker. But given that the country is operating under pandemic cloud, it would be prudent to leverage opportunities arising from the new normal to enhance preventive and curative health interventions, as well as social protection. These have for long been neglected, and times have come for us to comprehend the consequences before us. While other sectors are important, the first call for any competent government would have been to augment the health sector so as to preserve life and livelihoods. Right Honorable Speaker, I'm emphasizing to preserve life and livelihoods. This should be visible in government responses. A responsible government, Right Honorable Speaker, and of course a competent one at that, would A, democratically engage Parliament in determining a logical, comprehensive, and legitimate national response plan. Parliament is consuming rumors, Right Honorable Speaker. B, consolidate savings made across sectors during the lockdown periods, such as workshops, travels, government sponsorships in tertiary institutions, and capitation grants, among others, so as to channel them to critical response interventions in a national response plan, right, Honorable Speaker. C, target tax interventions such as waivers on payee for essential workers, such as medical personnel and teachers, so as to increase their disposable income, rental tax to make accommodation affordable, and VAT adjustments, particularly on utilities, among others, as a means of sustaining livelihoods. D, halt implementation of new projects, such as the parish development model and allocations geared towards the implementation of a national response plan. E, negotiate with external partners to deter non-critical projects and commitments so as to free government of Uganda funding towards pandemic management. And F, resuscitate decentralization through devolving powers, authority, and public funds from the central government, local governments, so as to ensure effective pandemic management in the communities, right, Honorable Speaker. Let me briefly comment on funding for the COVID resurgency. The Prime Minister disclosed to this Parliament, right, Honorable Speaker, that by March 2021, government had developed a resurgence plan, despite repeated calls for a costed plan, and the two are different. Government was adamant in laying it in Parliament so as to inform budgeting. Right, Honorable Speaker, you are aware, and members, that when we were debating the current financial budget, we did implore government to be very clear on the key allocations to health targeting COVID, but it was general provision, not particularized provisions, right, Honorable Speaker. Parliament that holds powers over the purse is still unaware on the extent of the plan save for disclosed component of health, which is in the range of 1.32 trillion. The bulk of the allocations are towards the pillar of logistics, which consists of supplies, personal protective equipment, oxygen, patient care, among others. The rest of the pillars include surveillance, laboratory, case management, communication, among others. Right, Honorable Speaker, it would have been helpful to disaggregate the allocations in each pillar so as to establish what has been prioritized. The House is questioning the priorities of government, right, Honorable Speaker. Aggregation raises risk of funding wasteful items.
Look,
Yes, Madam
can
Speaker.
you furnish the Prime Minister with your copy?
There's no
Copy
copy?
of your response? She doesn't have a copy.
Unlike her, I saturated the copies, but I can.
No, she,
They're on the system.
just give it to her.
Thank you for indulgence, right, Honorable Speaker. I'm always available to help my sister in case of any gaps. Right, Honorable Speaker and colleagues, I was saying that it would have been helpful to disaggregate government priorities to avoid wasteful expenditure. Remember, during the first COVID response, monies were allocated to advertising on billboards when people are under lockdown. So we had areas accruing to media houses because of misallocations. That should have been avoidable where allocations were transparent and shared. That, Honorable Speaker, we generally can observe that focus of the resurgence plan is on curative rather than preventive services. This is deduced from the minimal allocation towards surveillance and vaccination, which are understood to be effective in deterring spread of COVID. For instance, right, Honorable Speaker, out of the 1.32 trillion, I only figure out 2.62 billion allocated towards vaccination. This is far short of the Ugandan shillings 1.4 trillion that was indicated in the National Development Vaccination Plan as estimated cost for a national rollout of vaccines, right, Honorable Speaker. The statement further indicates that For the period July to December 2021, shillings 372 billion was required to fund activities of the Ministry of Health. Unfortunately, this proposed allocation is not disaggregated. It is therefore difficult to appreciate what it is meant to do. Furthermore, Right Honourable Speaker, the statement is silent on whether the funds were included in the approved budget for financial year 2021-22 or not. In the event that the funds were not included within the approved budget, it would be prudent for the Committee on Health to scrutinize the whole resurgence plan and guide the House on the next course of action, Right Honourable Speaker. Though not comprehensively done, Right Honourable Speaker, we commend government for an attempt to reviewing the approved budget. It has communicated that the budget is going to be reviewed to suppress particular expenditures that are deemed nugatory in the circumstances. But the last time we checked, Right Honourable Speaker, the funds so far raised from the suppression only yield 600 billion, away from a target of 2.55 trillion. A review, so the funds are targeted towards the supplementary budget for COVID emergency, and a review of the supplementary, Right Honourable Speaker, indicates that health sector was to receive 206 billion out of the total of 600 billion. That's 34% or thereabout. Majority of the funds are towards the presidency, defense, police, and intelligence services, among others. Going by the recent past request through supplementary, the funds are usually targeted towards routine activities that can be accommodated within the approved budgets, Right Honourable Speaker, which is why we are questioning what government is spending from the suppressed expenditures. In the interim, Right Honourable Speaker, before Parliament considers the resurgence plan, every additional penny mobilized should be geared towards vaccination and critical underfunded items in health. These are the game changers in normalizing citizen lives and the economy. We are aware, Right Honourable Speaker, that the government cannot handle COVID by simply allocating on this and that. Vaccination to us is the game changer. Commenting briefly, Right Honourable Speaker, on vaccination, the Prime Minister is right to be concerned. He's very right with the low vaccination rate of 4% of the initial target of 21.9 million eligible population. With this progress, Right Honourable Speaker, we can only cover the target population in 12 years, probably about 2033. This is largely attributed to over-relying on donor-driven COVAX facility and donations from countries such as Norway, India, China, among others. This measure approach, Right Honourable Speaker, of acquiring vaccines is alarming and shameful, to say the least. It is an indictment on the ability of government to guarantee lives of Ugandans during the pandemic, Right Honourable Speaker. Direct orders to manufacturers are almost negligible. Apart from an order placed to Serum Institute of India for AstraZeneca, it seems no other payment has been made. And remember, Right Honourable Speaker, that this was a total of 18.5 billion, and the government paid out to confirm the supplies. Instead of owning up its failure in making quick full payment in time, government is blaming in the Indian government for restricting vaccine exports. How come countries that had paid up were able to access their vaccines? Right Honourable Speaker. Nothing stopped the government from making payments to other manufacturers, as our neighbors Kenya did, and so other countries have did, to the private suppliers. The Prime Minister would love to inform Parliament that they were stopped from making orders from other suppliers. Instead, the government has just remitted funds recently through the cost-sharing framework of COVAX facility, as well as initiated legal requirements to procure Johnson & Johnson through Afri-Exim Bank and African Union. This is the signature tortoise emergency response of government, Right Honorable Speaker. And we hesitate to be part of that approach. Right Honorable Speaker, during the recent reading of the budget speech, 2021, it was highlighted that 560 billion Ghana shillings will be provided for purchase of vaccines. Unfortunately, this allocation is not traceable in the approved budget for 2021-2022. What is traceable is the fact that the Minister of Health had indicated that in financial year 2021-22, it had a funding gap of 500 billion to purchase COVID vaccines. But in actual allocation, it's non-existent and non-traceable. With these contradictions, Right Honorable Speaker, it's difficult to determine with certainty whether funds have been committed or set aside for vaccine purchase, Right Honorable Speaker. We hear rumors in the corridors about possibilities. We want confirmation in quantities and dates, Right Honorable Speaker. Right Honorable Speaker, let me comment about, in general terms as I conclude, the critical prevailing deficiencies. For a while, Right Honorable Speaker, the country has been gripped with deficiencies in beds, oxygen cylinders, personal protective equipment, and ambulances. To the contrary, and avoid of reality, the Prime Minister reports that the country has reasonable bed capacity to manage the pandemic. It is in her statement. Had the country had sufficient bed capacity, why would people go for home care as a priority with all the risk attendant to home care? It is vital to note that just a month ago, the President made an undertaking that government was to install 300-bed field hospitals per regional hospital. We construed this to be a government assurance, Right Honorable Speaker. We wait for progress to date on this emergency, Right Honorable Speaker. The President also informed the nation of a roaming shortage of 22,800 cylinders of oxygen per day. While Global Fund intervened to install 7 oxygen plants in Kampala, Arua, and Hoima, Fort Portal, Mbarara, Lira, and Mbale hospitals, most of the facilities in Uganda continue to be constrained by insufficient oxygen supply. Unfortunately, the Prime Minister is silent on how many health facilities lack adequate oxygen supply and what interventions are to be taken to fill the gap. In the recent past, Right Honorable Speaker, when a funding gap of 1.4 trillion for procurement of oxygen cylinders in the 14 regional hospitals was presented, Parliament promptly made the funds available. This is an indication that critical affordable funding gaps can be filled without necessarily relying on external funding, and especially donors. Unfortunately, Right Honorable Speaker, it has been observed that health sector almost entirely relied on external funding for its development budget. In the just concluded financial year 2021 budget, out of the approved total development budget of 1.4 trillion, external funding accounts for 85%. The government of Uganda development funding was a paltry 2.5 billion. The country, Right Honorable Speaker, needs to reprioritize. The country has for years grappled with shortages of functional ambulances. This has been highlighted during the second wave. It is worrying, Right Honorable Speaker, to note that only 45% of health facilities in Uganda have an ambulance in singular. Majority of the ambulances are non-government ambulances. In the first wave, the Minister of Health extended a request to members of Parliament to volunteer their constituency ambulances to implement those to complement those of government. The citizenry also donated towards the purchase of ambulances. Instead of addressing ambulance shortage, cash donations from the population were used to procure 282 pickups. This is the misguided judgment and ill-guided expediency on the political leadership of a suffering nation, Right Honorable Speaker. The deficiencies in public health facilities, Right Honorable Speaker, in terms of beds, oxygen, and ambulances, among others, have been filled by private health facilities. This is attributed to the fact that government has been relegated to a regulator and fronting the private sector as the service provider. This has in effect escalated the cost of health care for the citizenry. In normal times, it had been realized that out-of-pocket per capita expenditure has risen from 41,000 Ghana shillings in 2008-9 to now 62,000 in 1920. This is not affordable, Right Honorable Speaker, by majority of the citizens. To make matters worse, during this COVID pandemic, treatment costs have soared to over 3 million per day. Sadly, the Prime Minister falls short of articulating which interventions have been undertaken by government in collaboration with the private health facilities in making COVID treatment affordable. But she has made a general statement that is inconclusive and bears no direction. In a bid to save lives, Right Honorable Speaker, it is our cautionary view that government extends support to private health facilities in the form of incentives such as tax waivers on utilities, deployment of medical personnel, joint procurement of drugs, and the supply of oxygen. This should subsidize cost of medical care in private facilities. Right Honorable Speaker, I'm about to end my statement. Bear with me. Let me speak about decentralization of service delivery under COVID. Article 176, Right Honorable Speaker, of the Constitution of the Republic provides for a decentralization system of governance. It empowers local governments to plan, initiate, execute policies in respect of all matters affecting their jurisdictions. Right Honorable Speaker and members, whereas local governments exist, the central government has for a long adopted a divergent decentralized system in intent and stature. Local governments have been robbed of their constitutional development functions, powers, and responsibilities. This has largely been actualized through budget allocations. For instance, Right Honorable Speaker, in the supplementary budget funding for COVID for financial year 2021-2022, local governments were allocated only 52.8 billion out of a total of 600 billion. This translates to only 8%. Furthermore, Right Honorable Speaker, Kampala City, the epicenter of the second wave, was not allocated any supplementary allocation. Kampala, the epicenter, no supplementary for it. For the local governments that were considered, each received less than 800 million. Yet Office of the President was granted supplementary allocation of 6.9 billion. So based on the supplementary allocation, Right Honorable Speaker, the epicenter of COVID-19 is the Office of the President, and it deserves better consideration than local governments. Right Honorable Speaker and members, the relegation of local governments has been exemplified in the management of the COVID pandemic. Local governments must plead and wait for supplies of vaccines, ambulances, drugs, and PPEs from the central government. Decentralization of developed functions is unconstitutional and the main cause of the lukewarm COVID response of local governments. Right Honorable Speaker, of late, resident commissioners, RDCs, with the support of security forces, have, in contravention of Article 183, 1A of the Constitution, been positioned to be the de facto political heads of local governments in the response to COVID. Their actions are unconstitutional and ultra-vires the law, Right Honorable Speaker. This has led to unlawful restriction of COVID response meetings. So RDCs can stop local government from convening, deliberate on their constitutional obligations towards their citizens because the center has recalled their powers and constitutional, Right Honorable Speaker. This has led to, so no wonder no local government all local governments are ill-prepared to manage the pandemic. In a bid to facilitate local government, Right Honorable Speaker, in managing the pandemic, Parliament should with immediate effect be informed of the COVID response funding gaps in the country. They should expeditiously be scrutinized by the appointed committee of Parliament and the House guide on recommended course of action. Let me comment on the pet project spearheaded by the Right Honorable Prime Minister. That is the support to indigents called the Honorable Nabanja Fund, Right Honorable Speaker, whatever it is. It is quite unfortunate that the focus on COVID response is being reduced to only 100,000 shillings as a cash transfer to the vulnerable workers. The cash assistance has been derived from a proposed minimum expenditure food basket, which includes posho, beans, soap, and cooking oil. One wonders whether the food basket is equivalent to the recommended balanced diet, nutrients, or calories that a person requires to sustain life and boost immunity against COVID. Whereas the cash relief gesture is welcome, Right Honorable Speaker, its implementation is pretty much discriminative. And I heard the Prime Minister trying to justify discrimination. Last year, the Uganda Bureau of Statistics established that Uganda has 5.11 million vulnerable workers. Unfortunately, the same institution, I think, has been pressured to consent and facilitate registration of only 501,107 vulnerable workers. This means that 90% of the vulnerable workers are excluded from the relief intervention, even with vivid statistics available to the Prime Minister and her government to respond. These are reservations regarding the criteria that the interventions, the National COVID-19 Task Force used to identify the 13 categories that she mentioned earlier. Irrespective of the criteria, most workers or individuals are not registered in a centralized place, nor regulated under associations that would act as centers of enrollment and verification of beneficiaries. Many are outside the realm of trade licenses that would require them to be captured in the records of town clerks, as was guided by the task force leaders chaired by the Prime Minister. The categorization is conveniently selective. For instance, Right Honorable Speaker, the shop attendants in the closed arcades are not included. They earn a daily living. Of late, market traders raised concern that even though they were allowed to operate, majority of the customers cannot reach their stalls due to traffic restrictions and lack of earnings. They are not different from categories that have been considered, such as car washers, who wash few cars, border riders, whose returns from cargo transportation are far less than the proceeds from passengers, musicians and comedians who earn minimal commission from online platforms. Justification for inclusion of these was premised on their earnings being substantially reduced during the lockdown. This therefore raises issues of fairness in categorization of beneficiaries. Right Honorable Speaker, outcries have also been heard from university students who were unable to return to their homes due to the inflated transport costs and limited days of travel. These too are vulnerable, but have been excluded from vulnerable persons. The minister responsible for gender did indicate that such vulnerable persons who are not workers will be catered for later without any commitment to a time frame. Therefore, the categorization of vulnerable beneficiaries as agreed by Cabinet promotes exclusion and entrenches inequalities. It also exposes the vulnerability persons such as the terminally ill that depend on support from workers to the risk of death. Apart from food, Right Honorable Speaker, the cash relief did not consider other costs of daily living, such as rent, water, electricity, and medical care. These costs ought to have been incorporated in the computation of the cash transfer amount. How would one cook the food without water or energy? Where will they cook and eat from when evicted from their homes because of rent. These are COVID patients in some households. Will they be treated on the 100,000? Yet hospitals are charging medical fees up to 3 million daily, and we know the thin spread of government facilities throughout the country, Right Honorable Speaker. The beneficiaries, Right Honorable Speaker, of the households are expected to have MTN or Airtel mobile money lines, as well as the national identification number, NIN. It was indicated that one may access the cash relief with just a NIN at a mobile post bank of van. The distribution mechanism raises a transparency concern, for no competitive procurement process was undertaken to award the contract to Post Bank and telecom companies. So how was this chosen? And how is this reached to be able to be the one to deliver relief to citizens, Right Honorable Speaker? More still, Right Honorable Speaker, the registration process of beneficiaries was hijacked by regime apologists, particularly RDCs, in disregard of local leaders. These are firms that government only appreciates the role of local leaders when they're involved in general elections. Therefore, Right Honorable Speaker, in such exercises, they are deemed to be competent and among the lead stakeholders, but not in identifying vulnerable persons that they lead daily. Consequently, the beneficiary enrollment process has been flawed, exposed to manipulation for patronage and political gains. This is not news, for it has been evident in relief enrollment of musicians, promoters, bouncers, ghetto youth during and after the election period. It is our considered opinion, Right Honorable Speaker, that every vulnerable person is considered for the cash relief and derivation widened to incorporate utilities, rent, minimum medical care package for the citizens. Irrespective of continuance of the lockdown, Right Honorable Speaker, community-based models that are hinged on the local council system should be used to record, maintain, update registers of vulnerable within their respective communities. This would reduce response time in future lockdowns or if a disaster befalls an area. The registration of vulnerable people should not be an emergency. They should be in existence for a record to be called whenever required, Right Honorable Speaker. Right Honorable Speaker, it's worth noting that there are some vulnerable persons who would not be categorized as if they were able to access benefits that are accrued to them. In this regard, the President is urged to assent to the NSSF bill so that savers access their midterm payments. This would lessen the economic impact of COVID in the eligible households of the 1.5 million members of NSSF. There's no point for the contributors to die of hunger and stress only for the dependents to access and enjoy their savings. Otherwise, one wonders why NSSF would entirely transfer the burden of assisting these contributors to government that seeks to exploit their contributions. We believe that the Prime Minister probably in her response would inform the country why the President has not up to now assented to a bill that was passed by the 10th Parliament, Right Honorable Speaker. Right Honorable Speaker, let me comment as my last comment on accountability of past COVID interventions. Since financial year 2019-2020, several interventions have been funded in response to COVID-19, Right Honorable Speaker. Regrettably, a lot of it has been wolfed through systematic corruption tendencies of government. Unfortunately, the Prime Minister was silent on the vice and the risk it poses in the second wave COVID response. In 2020, Right Honorable Speaker, the Budget Monitoring and Accountability Unit reported that verified deliveries are fewer than what was paid for. For instance, joint medical stores delivered 1,000 beds, but the monitoring team was only able to verify only 331 beds. In other instances, it was noted that MS Silverback Pharmacy was fully paid before making deliveries, that were costed and inflated. The company was contracted to provide 2 oxygen plants and 450 cylinders at Ugandan shillings for 6.4 billion. Yet earlier, the same cost delivered oxygen plants in 13 regional referral hospitals. Whatever changed in a very short time, probably the Prime Minister or the Minister of Health at an opportune moment should be able to explain to the country the sudden change of costing for these facilities. Separately, Right Honorable Speaker, the Auditor General, in his recent report of 2021 February, noted that flouting of procurement regulations, mismanagement of quarantine centers, mismanagement of cash donations, ghost receipts of in-kind donations, and mischarges, among others, were problematic as accounting gaps. Based on the above, Right Honorable Speaker, the public generally concerned and very suspicious that government will continue to prey on public funds, borrowing a leaf from one of the recent transparency conditions for accessing International Monetary Fund loans. All details of contracts of COVID procurement should be published on the website of the Ministry of Finance, Planning and Economic Development. Publish lists of procurement detailing winning bidders of contracts of any monies above 500 million for works, as well as above 200 million for goods and services. The list detail items procured, method of procurement, service provider, the shareholders, contract value, status of procurement, source of funding, among others, Right Honorable Speaker. These would give confidence in the citizens that there is a government that cares and is accountable. Lastly, Right Honorable Speaker, the Prime Minister rightly observed that globally, there is no perfect system. And I want to agree with her statement. But unfortunately, Ugandans do not subscribe to a global system. They subscribe their taxes to a government of Uganda. And that government should respond without referring us to other jurisdictions. Because if you compared with what other governments have done, the Prime Minister will throw in the towel tomorrow, Right Honorable Speaker. I want to thank you, Right Honorable Speaker, and members for listening to our view and the considered approach to this problem, Right Honorable Speaker, as a response to the government current wobbly position. I thank you, Right Honorable Speaker. I beg to submit.
Thank you so much, Locke. We've had a response from Locke. And since what is being drilled on is mostly on health, before we go to a debate, I really want to hear from the Minister of Health on what is happening. And when you're discussing, I want you to bring in the issue of ambulances, how far you've gone with ambulances in all the districts. Then two, the allowances for health workers, whether it has been sent to those people. Three, whether the purchase of the 280 pickups is not a mischarge. And then what plans you have for vaccine? Because the only solution we have for COVID-19 is purely vaccine. And I also have a petition in my office from students, internal and international students, who did not travel back to their homes after the closure. Prime Minister, we need to see what to do with those students. Honorable Minister of Health, we want to hear from you before we put the debate.
Right Honorable Speaker, and honorable members, allow me to thank you for this opportunity for me to respond to a few issues. I'll start by appreciating the Right Honorable Prime Minister, who has clearly given answers to most of these issues in her statement. And clarified on many of the issues that are being brought to light. Right Honorable Speaker, I have listened very attentively
Honorable Sewongo, members want to debate on this thing. He only raising an order because a leader of opposition was not appreciated. I mean, we are teaching these young people bad manners. Huh? I know. Okay. Right on, Lob, thank you for your report. So you sit. It was a very exhaustive report. Thank you.
Right Honorable Speaker, allow me first of all to start by highlighting a few issues that came up in the report of the leader of opposition on the resurgency plan. Right Honorable Prime Minister, apart from the Parliamentary Task Force on COVID-19 that requested me for a response plan, I have never received a letter requesting for the response plan. And in any case, the leader of opposition makes mention that the Ministry of Health indicated the total cost of the response plan in the budget. Right Honorable Speaker, how would I have come up with that figure if there was no response plan and it was not disaggregated? I want to assume that the leader of opposition meant a holistic response plan covering all sectors. And in that case, we can bring a response plan that covers the entire country, but it will not be from the Ministry of Health. The response plan definitely prioritizes logistics because we require that for management of patients. But that does not mean that government has not catered for prevention. Right Honorable Speaker, we have made all efforts to secure vaccines. Vaccines are not available on the market. The global demand outweighs the production. And many of the rich countries have paid for many months to come. It is therefore difficult for many African countries to secure vaccines. And that is why the Right Honorable Prime Minister in her statement said, government is making a multi-pronged approach, including direct procurement from the manufacturers and all available sources like the COVAX facility and the African Union. Right Honorable Speaker, it is true that government allocated 560 billion for vaccines. To date, 101 billion has been provided. We have so far only managed to pay 3 billion to the African Union that communicated that they will be able to release 2 million doses of the Johnson & Johnson vaccine to us. We have not paid to any other supplier because the vaccines are not available. In the Right Honorable Prime Minister's statement, she indicated that vaccination is a priority, and government resolved that it is a priority so that we can open up the economy. Government is making all efforts to secure vaccines, including tasking our missions abroad to work with the manufacturers and identify available sources so that we can pay for the vaccines. Right, Honorable Speaker, you have requested to know whether the 282 vehicles was not a mistake. I want to state here very
It's not
clearly.
a mistake per se. A mischarge is an accounting word.
A mischarge.
A mischarge, not a mistake.
Right, Honorable Speaker, the funds to procure these vehicles was a call by His Excellency the President. The money was received by the fund task force that was appointed, banked in the fund account that was opened, and transferred to the consolidated fund. And it was only after the committee chaired by His Excellency sat that funds were allocated to the various components that were read by the Right Honorable Prime Minister. Right Honorable Speaker, from the beginning of the pandemic, the World Health Organization was hiring 200 vehicles to support the districts for surveillance, for transporting samples to Kampala, and for other activities. It was extremely prudent that pickups are procured to facilitate districts carry out surveillance. Ambulances are not used for surveillance, and ambulances cannot transport samples. So the pickups were not a mischarge, and the districts will definitely appreciate the pickups. Right, Honorable Speaker, in the first supplementary that was allocated to Ministry of Health, funding was provided for 30 ambulances, in addition to the existing ambulances. These were procured, including 3 boat ambulances, and deployed as per the Emergency Medical Services Policy and Strategy. Allow me to inform this August House, Right Honorable Speaker, that ambulances are not deployed per district, and neither are they deployed per facility. According to the policy, ambulances are deployed per region and managed through the regional referral hospitals. And currently, there is a network of ambulances that are ferrying patients from facility to facility and to the center. Right, Honorable Speaker, you also mentioned about health workers. Allow me to inform you, Right Honorable Speaker, that allowances are paid to health workers who are taking care of patients in the isolation facilities. In addition, there are also surveillance officers and laboratory officers. All these health workers have been paid their contract sums of salaries and allowances. But this is a continuous issue. It does not end because the allowances are paid per day. And government will continue to pay as the pandemic evolves. Right, Honorable Speaker, on the issue of international students, you have allocated that to the rightful ministry and to the Prime Minister. I thank you for giving me the opportunity.
Thank you, Minister of Health. Minister, just for information,
Clarification,
it's not
Madam
that we
Speaker.
are blaming government, but I want you to appreciate one thing. In every district we have, Works has a vehicle, Health has a vehicle, a pickup, RDC's office has a pickup, CAO's office has a pickup, then LOC5 has a pickup. Wouldn't those vehicles be used for surveillance?
Clarification, Madam
Wouldn't
Speaker.
we use the vehicles, the money we are spending on buying the pickups on other things? Just a food for thought for you.
Clarification, Madam Speaker here.
Honorable Nabanja, do you have anything to say before we put a debate?
She will respond.
Honorable Nabanja,
Clarification,
kindly
Madam
take note
Speaker.
of the questions.
Clarification.
Members,
Clarification, Madam Speaker.
members, I am putting the debate, the report to debate.
Clarification
I
here.
don't want issues of clarifications. If you're coming, come and debate on the report.
I'm here then, Madam Speaker. My name is Baka. Baka Stephen, Bukoli County North.
Yo,
Baka Stephen, Bukoli County North.
unfortunately, I
Madam
don't see
Speaker,
people.
this
Okay.
side.
Yes,
Right.
Stephen.
Right Honorable Speaker, my name is Baka Stephen, Bukoli County North, Bujiri District. Madam Speaker, I wish to thank the Prime Minister and the Leader of Opposition for a statement well made. The Leader of the Opposition's statement was very elaborate, as if it were a response to the State of the Nation address, but all the same, thank you very much. Now, Madam Speaker, I rise on the issue of beneficiaries. At what point did we agree as a government or as a parliament that vulnerable people, the borders, you told the people, those of saloon operators and the massage parlors are only found in the towns of the level of a city and municipality, to the extent that only beneficiaries from cities and municipalities were recorded. Right Honorable Speaker, by only selecting cities and municipalities, they left out the deserving vulnerable people from town councils and small towns of this country. So therefore, I wish the Prime Minister to come and tell us what happened, how did they agree at such a level to agree that only municipalities and the cities would benefit. I want the minister, the Prime Minister, to agree that it was a mistake, go back, look for money, such that our people in the
Members,
villages can
other members
benefit.
sit as one is making a submission?
Such that our people can benefit across the country.
Can
And in
other
this-
members first sit?
And in this, Right Honorable Speaker, the Prime Minister should not say.
Can other members first sit as Stephen finishes his submission? Dr. Peya, can you sit?
Thank you, Right Honorable. Right Honorable, as I wind up, I request the Prime Minister and her team to go back and consider all deserving beneficiaries who are across the country other than in municipalities and cities, such that they get the money. And in this, I should not hear, the House should not hear the statement that there is no money. There is money, Right Honorable Speaker, because I heard a rumor that they have started the budget cuts starting with the Parliament. And this matter should be brought for debate because these budget cuts should not be localized to Parliament only. They should be across government, starting with the State House, down to the municipalities, to the local governments, across government, such that we have enough money, our people should benefit, and also revamp the health sector, which is limping, as we shall hear from the report of the ad hoc committee. I thank you very much, Madam Speaker.
Honorable Sarah,
Madam Speaker, in addition,
Sarah Opende.
Thank you. Thank you, Right Honorable Speaker. Right Honorable Speaker, I want to thank the Prime Minister and the Leader of Opposition for their statement.
Members, I'm giving you only 2 minutes each. Everybody wants to debate.
Right Honorable Speaker, one of the issues that I wanted to raise was on the town councils. While we are talking about town councils, there are those new town councils that have just been created. But there are town councils that have existed for a very long time. For instance, if I look at Malaba Town Council, Right Honorable Speaker, you have been there. This town council, most of the people survive through cross-border trade, and their businesses have been affected because the border has actually been closed since the last lockdown in 2020. We have raised the issue here of the small gate. The Malaba Town Council that you knew is actually a ghost town, and most of the people do not have any means of livelihood now. It was quite disappointing for my government to actually exclude such town councils, the old ones that have been in existence. I pray that despite the closure of this little token that government was giving, it should still consider these old town councils where people's livelihood. I want to close, Right Honorable Speaker, by also raising the issue. We are talking about lack of vaccines, but Right Honorable Speaker, while it is true that we don't have adequate vaccines from the suppliers, we have our own people here in country who have come up with supportive treatments like Professor Gwang, Right Honorable Speaker. We all have been reading what has been happening. The National Drug Authority, Right Honorable Speaker, cleared Professor Gwang's Covidex as a supportive treatment. And this gentleman has been requesting government to support him with the clinical trials, but also most importantly, mass production, since this vaccine, this Covidex is not harmful to human health. I want to know from my government what support it is giving to Professor Gwang. But also most importantly, we all know that we passed the Indigenous and Complementary Medicines Bill, which is now an act. We need to promote our own herbal medicines and not wait for the vaccines that we even don't know whether they are effective enough in dealing with these new variants, Right Honorable Speaker. Lastly, Right Honorable Speaker, I also want to know from the Right Honorable Prime Minister, we cannot wait for free vaccines. Why can't we accredit a few facilities so that those who can afford can get other varieties of vaccines from the private, not-for-profit hospitals or private for profit? Thank you,
members. The issue of Professor Gwang, maybe just for information, I'd given one of the commissioners to deliver. Professor Gwang has donated us 500 doses for the house. And in appreciation of what government has helped him in.
Madam Speaker.
Brenda, Nabukenya Brenda, you see, when you remain standing, I am not going to choose you. Nabukenya Brenda, this is not a market. Nabukenya Brenda.
Thank you, Right Honorable Speaker, for the opportunity. Right Honorable Speaker, I stand to comment on the Prime Minister's report in regards to the education sector. I have listened, Right Honorable Speaker, and waited to hear statistics, issues concerning continuity of education, but that were lacking. Right Honorable Speaker, in the last lockdown, the Minister of Education proposed a plan for preparedness and response in regards to COVID and emergencies in school. They went ahead and printed materials, self-study materials for learners from secondary school and primary schools, and also broadcasted lessons on radios. Right, Honorable Speaker, I would appreciate that. But in this second lockdown, the ministry has been silent. I got an opportunity to look through the self-study materials, and I realized that each material was for first term, for each and every class and every year. What if we are in second term? Are students in villages learning? Because due to the digital divide, rural areas cannot access technology. That means virtual learning cannot be effected in rural areas. Right Honorable Speaker, the silence from the Minister of Education is appalling. Ugandans want to know what is happening. Our learners in rural areas actually learning? We have an idea. I think this plan was brought in place with the notion that no one is left Right Honorable Speaker, 1 minute to conclude. We want to know from the ministry what is happening and also on the teacher welfare. Right Honorable Speaker, the welfare of teachers is priority because it has a multiplier effect on retention and the quality of education in schools.
Procedure.
Right Honorable Speaker, the president gave a directive that 20 billions be allotted to private teachers through a scheme. The Prime Minister has not mentioned anything in that area. This country is going to be affected in the future if the welfare of the teachers is not prioritized. Right, Honorable Speaker, we have sportsmen. This sector has been in lockdown for 2 years. The footballers are not in games, even all those who participate in games and sports. I didn't hear the Prime Minister include them into those who are supposed to benefit. I think the criteria used to determine who is the target group, who is a vulnerable poor, is not accurate. It's very poor.
Honorable Batua.
Yeah, thank you very much, Right Honorable Speaker. My name is Batua Timothy Lusala, Member of Parliament, Jinja West Constituency. Right Honorable Speaker, allow me address you as the Shadow Minister of Health. First and foremost, I appreciate the speech made by the Honorable Leader of Opposition. Very informative. And I want to assert and also affirm that lockdown doesn't cure COVID, and neither does it make the disease disappear. All that the lockdown does is to enable government to buy time such that it can mitigate the disease. Right Honorable Speaker, allow my office put it to your attention that as of now, there is no exit strategy that is visible to us and even the public for this particular lockdown of the 42 days. We seem to be in an indefinite lockdown. In the first wave, COVID-19 was a disease that was visiting upon us. It's at the points of entry that whoever was coming in was getting tested. And that approach was right. This time round, due to the laxity and the failure of the systems that were put in place, COVID-19 found its way in each and every village, in each and Right Honorable Speaker, grant me sometimes, since I'm speaking as the leader, as the Shadow Minister of Health. Yeah, and the other one also spoke until she completed that speech. So, Right Honorable, in a situation like this, we hope to see mass testing. Where it's not possible, at least we hope to see a scaled up testing mechanism, at least for the high volume areas. The people working in Chikubo, the people working in various malls. It is in this lockdown, in these last 2 weeks of the lockdown, that we would see effort of the government. Right Honorable Speaker. Speak.
Honorable Bigirwa Nora. And as the Bigirwa comes, I want to recognize the arrival of Her Excellency, the Vice President of Uganda. Madam, you're welcome. Noeline Kisembo. Kawalia. Honorable Kawalia.
Thank you, Madam Speaker. All honorable members of Parliament. I'm Kawalia Abubakar, MP Rubaga North, as well as the Shadow Minister for Kampala and Metropolitan Affairs. Madam Speaker, let me start by appreciating the report of the Honorable Leader of Opposition. And actually, at the same time, I'm also going to appreciate the Honorable Prime Minister, though we expected a lot of issues in her report that we've not heard about. I don't know, Madam Speaker, if the Prime Minister is aware about the exorbitant charges from Ugandans, most especially those ones coming from abroad, when they reach at the Entebbe International Airport. People have been charged with a lot sums of money, but I have not had any government official talking about that. We are yet to receive the communication from the relevant minister. Madam Speaker, since this is my maiden speech, I request you to give me 2 more minutes. Madam Speaker, Kampala being the epicenter of COVID-19, we have had a lot of challenges. And one of them is the brutality that has been raided or ordered by the RCC of Kampala. I don't know whether the office of the Prime Minister is aware on the way how the RCC of Kampala beats up our people by using guns without allowing them to access their places of work, most especially those ones who work in markets. And Kampala being the business center of this country, most of our people get what to eat by accessing markets like St. Mary Kudembe and others. But we have seen the RCC of Kampala negligently ordering brutality to our citizens, and we also expected such a communication from the report of the Prime Minister. Madam Speaker, there's another issue of ambulances. I have heard the Minister of Health speaking about the issue of ambulances, but it's quite humiliating that the capital city of this country, at the moment at City Hall, manages only 3 ambulances. Yet, Kampala has a population of Ugandans who reside within the boundaries of Kampala that totals to 1.7 million people. So, we are yet to hear from the Minister of Health why they have failed to allocate a budget to Kampala, because our predecessors in the 10th Parliament had allocated 2 billion in the. Currently, we've not had them commit themselves on how much money they are allocating to Kampala as far as the.
Honorable Apea. Dr. Apea.
Madam Speaker, thank you for giving me the opportunity. I would also like to appreciate the statement made by our Prime Minister, which has highlighted great efforts that government has put in place to address this cause. Madam Speaker, I'm here to make a comment on 2 issues. One, on the issue of vaccination. Our honorable leader of opposition made a statement that could alarm the whole country, that at 4% vaccination rate in the country, it means it will take 12 years. But I would like to inform our honorable leader of opposition that data from the World Research on COVID is showing right now, just 2 minutes ago when I checked, that even India, which is producing the vaccine, has just vaccinated 6.3%. And the average vaccination at the moment in the low-income countries is just 1.1%. I would like, therefore, to request that when we give statements, we shouldn't give statements that alarm the country. That in the whole East Africa, Uganda at 4% is actually doing very well. Kenya has just vaccinated 1.1% and Rwanda 2%. So I would like to really thank our government for doing all that it can to make sure that the vaccination program is implemented as scheduled. The second issue, Right Honorable Prime Minister, is the issue of funding the pandemic. In the same response from the Leader of Opposition, highlighted the issue of the emergency funding that the Right Prime Minister highlighted, the 372.8 billion, as well as the resurgence plan of 1.3 trillion. I carefully read that report and analyzed and recognized that yes, there is only a budget of 2.6 billion for vaccination, but that does not mean that the government has not prioritized. My analysis of that report meant that that budget is as little because there's already allocation for vaccination. And that is why we saw that budget. And on that note, therefore, the emergency plan, in my view, and in that report, would really be able to address the issue of home-based care and community response that has proven to work in our country. I would also like to reiterate the report, the presentation of our Honorable Prime Minister of Health on the issue of ambulances being allocated to regional hospitals. The issue of the boat ambulances. I would like to know from the Minister of Health that there are districts like Amolatar, which is a peninsula, covered by Lake Hyog and Lake Kwania. Could it be possible enough that such districts and island districts are considered, irrespective of your health policy, of allocating ambulances only to referral hospitals? As we talk now, my district, 60% of the district is cut off by water. For you to access another community, you need a boat to go there. Meaning that if anybody falls sick in those communities, there is no way for them to access these medical services. Finally, right from
Minister of Health, that myth of saying that the ambulances should be at regional level is far-fetched. We should have ambulances at district level. What was the essence of you? What was the essence of having district hospitals? Honorable Minister, I'm talking to you. Yes, we need ambulances at district level. Honorable Akelo Lucy. Honorable Akelo Lucy is on Zoom. Lucy.